as well. There we go. And then I would love to welcome you today, Morna, to our live stream and to what will be our podcast. So thank you so much for joining us, because I know you have lots and lots of information to share. And there's lots of really good things going on at the National Centre for Farmer Health, which is based here in Hamilton. But before I talk too much about that, because I have a bit of background there myself, I'm actually going to hand over to you just to introduce yourself, what your role is at the National Centre for Farmer Health, and then might even start off with I guess, a general overview of what the National Centre for Farmer Health does, because there will be a few people out there who maybe haven't heard of it or don't know what you guys do. So let's start off with that. Let's kick it over to you.
Okay. Oh, look, thanks so much for the invite, Di. I really appreciate the opportunity to spread the word a bit about what I do at National Centre for Farmer Health. I've really enjoyed listening to your podcast, so hopefully your listeners will find my story interesting too, and hopefully helpful for themselves and their friends and their families. So, and I'm not sure how far this podcast will actually spread. So that's always the unknown with podcasts, I guess, Di. So firstly, I'd like to acknowledge the traditional owners of the many different lands on which we virtually meet or view this podcast, and pay my respects to elders past and present. I'm in Gunditjmara country right now, but I was actually born on Kamilaroi country, which was a beautiful part of New South Wales. So my role is a bit of a dual role at National Centre for Farmer Health. I'm actually a registered nurse, and I'm also an AgriSafe clinician. So I gather you're pretty interested to talk about that particularly, and I'm happy to explain that and what that actually means in practice a bit further on in the podcast. But maybe it could be helpful by just introducing myself as well, because I'm actually a farmer myself, a parent, a wife, a grandmother. I wear a few other volunteer hats from time to time with CFA and Landcare and bit of work with Parkinson's group. So I like to give back a bit to the community who I think that's really important for me. And I've been a farmer for, sorry?
I was going to say, and I think that's a very common trait of people who do farming and work in the agricultural space and live in these smaller communities, is that we do have many different hats that we wear within those communities. So
absolutely.
And that can be sometimes an added stress, and sometimes it can work as a positive for us as well. So that might be something that we talk about today too.
I'm sure we can, So I've been farming for 32 years here locally, and I definitely don't come from a farming background. I think both my husband and I, when we decided to go farming all that time ago, 32 years ago, after we got together, our parents were definitely not farmers. So although we had a passion for it, we were the first to admit we had lots to learn. In fact, I think probably most people thought we were a bit mad tackling such a venture.
Wow.
And
so neither of you were from farming backgrounds?
No.
Wow, that's actually not that common, is it? Because often they're handed down through generations, or farms are handed down through generations. So that's really interesting.
That's right. So it's really been a bit of a roller coaster for us, but I guess, we've rolled with the punches and we've adapted like most farmers do. Farmers are pretty adaptive.
Very.
And you're right, you touched on that, they're part of the community. So I guess, we've learned a lot from our community, and we just love we feel really blessed to be in a wonderful part of rural Victoria, really. So, so anyway, back to my professional role and what I do. I work as a AgriSafe clinician registered nurse, but I also do a range of other tasks as they arise at the National Centre for Farmer Health, basically in areas where my registered nursing skills can add a bit of value, because AgriSafe is just one of the services that we offer, and we can touch on some of the other ones a bit later on perhaps. But we're really, we're part of Western District Health Service, but we work really closely with Deakin University as well. So we do research, we do the clinical work that I'm going to be talking a bit more about today. We advocate for agriculture. And we're really focused on making a difference to farmers' lives, because farming is really important. Farming, it provides us with all the food and fibre that we need in our lives.
Well, absolutely. And not to try and make this political at all, but I think that's kind of been honed in with the fact that China has actually stopped a lot of imports at the moment into Australia.
Yeah.
So we're having to go back and actually rely on our own agricultural sector. Whereas previously, to save a buck, we've kind of exported or imported goods. Now we're having to provide for those ourselves, and the agricultural sector has actually become not much more important. It's always been important, but I feel like it's come to the forefront a little bit more in people's awareness, which is actually a really good thing for our country, I think.
Yeah. And I guess that's one other part of the National Centre for Farmer Health. We operate locally here in Hamilton, but we provide services in Victoria from a state perspective, from a national perspective, and we've got linkages internationally as well. And in fact, that's where AgriSafe actually started, in America, in the USA, and we've actually adapted it for the Australian setting. So I guess that's a nice little segue, Di.
That is. So tell us a bit about AgriSafe. What is AgriSafe, and what does it involve?
Okay, so it's basically a 90-minute session. It's completely free, and it's for anyone who's working in the ag space, and it focuses on assessing their health, their well-being, and their safety practices in their individual unique enterprise. So, no cost other than the farmer's time. And I work hard to make sure they get value for money, and that every 90 minutes at that clinic really count, because farmers are really busy. They really are. Yeah. And it's delivered by accredited registered nurses in a few different areas across Victoria, and they all have extensive knowledge of farming and ag as well as health, and we all keep connected for professional development, reviewing our service, keeping it relevant. And so
when you spoke, you said that it's for people who work in the ag space. So often when people might look at a program like this, they'll go, well, that doesn't really count for me because I'm not a farmer as such, like in the traditional sense. So tell us a little bit more in depth, I guess, about who might be eligible actually for that service and who can access.
Sure. So there's loads of types of participants that I've seen over the last few years. So think farmers, think shearers, contractors, vets, agronomists, stock agents, farm labourers, horticulture, sheep, beef, cropping, fishery, aquaculture, vineyards. I've had participants who work on 5 acres breeding a specialty crop, up to farmers who've got thousands of acres. So, it really varies to, dairy hands who travel to and from a work site, contractors. So it's pretty broad.
Yeah, and a lot of seasonal workers too, I imagine.
Yeah, that's a fantastic opportunity to see if we can get seasonal workers as well. It's sometimes getting them involved and getting them to us, and finding that link is really important. They don't actually need a referral from a GP or anything. They can just register online, hop onto our website, and just express an interest, or they can just ring me and call and have a chat. So if anyone who's listening thinks, Morna hasn't actually mentioned what I do, but I wonder whether I might be eligible, feel free to get in contact.
Yeah, just contact and ask the question. There's certainly no harm in asking, is there?
Yeah,
and so
that's right.
when you go into an appointment, how is an AgriSafe appointment different to an appointment that you might go to your traditional GP for? How does it differ? You said it's 90 minutes to begin with, which is a bit different to say the 10 or 15 you might get with your GP.
That's right.
So it's obviously a bit more in depth. So tell us a little bit about that depth.
Sure. So, great question. There are a few things about the AgriSafe concept that makes it really unique. But, I do want to emphasize we do not work in isolation from the GP. So what we do in the clinic together, really helps build a big picture of that individual and their lives. And that can really help the GP. So it's a bit of a team effort. And so when that person goes back to the GP, then the GP can really drill in on the key issues for that person. So the clinic work really allows the GP to get targeted information, and it actually saves them a lot of valuable time as well. And as you said, that's pretty rare to get 90 minutes uninterrupted with your GP. So we certainly give the results back to their GP with the farmer's permission, of course. What else is there that's unique about the service? We test a range of issues, and we can talk a bit more in detail about that. But we also do what we call point of care testing, which is basically a fancy term for saying you get the immediate results right then and there. I take a little bit of blood. It's you don't have to wait a week or take a pathology slip to line up and wait, then go back to the doctor to get the results. I can actually give you a couple of really key blood test results straight away. So that immediacy of the results, farmers really value that. It helps them see the relevance.
Saves them another appointment.
It saves time and get the implications straight away. What does this mean?
Yeah.
And
they
GPs
can actually
don't
talk
often
through the results with you on the spot as well.
Yeah. So, and we use ag as the starting point, I guess, for every aspect of what we do within the clinic and every conversation and chat that we have. And in fact, all of the assessment results that we undertake are given to the farmer themselves and to take home, along with a variety of resources. So, nothing's hidden, it's all transparent.
Yeah. And so in conversations I've had with you in the past as well, you've talked a lot about agricultural chemicals and what you do with those in the clinic. Can you tell us a little bit more about those and
Sure.
how you assess chemicals or how you test for them?
Yeah, we talk a lot about agrochemicals that are used in farming enterprises, and farmers use a lot of chemicals, whether that be drenches, vaccines, sprays, baits, and we educate the farmer about how those chemicals actually get a route into your body, into your bloodstream, and impact on your health. But more importantly, what they can do to lessen the chance of that happening. And farmers are really interested in that part of the assessment because I think they often don't know why or how to get more information, more accurate information. So that is really a very unique part of the service. So we can have a real chat about what they're using, and we actually get them to bring a list every time I see them around what is the exact chemical that they're using, what sort of personal protective equipment they're using. Did they use it for 5 minutes, or was it, were they on the tractor and spraying behind them? Were they on a quad bike? Were they just backpacking? Did they feel like they may have had some sort of exposure? So it's quite an in-depth sort of discussion. And then some of the blood tests that we do actually support identifying some trigger areas around the dangers for that as well. So basically the whole AgriSafe is about empowering the farmer to take control and manage all aspects of their health and well-being, just like they manage their crops and their soil and their animals.
Because I think often, when they initially learn about chemicals as well, because often you do have to do a chemical handling course to be able to use chemicals on your property, and they, within that course, they'll often learn, well, this is how you should handle those chemicals, but they don't actually learn about what actually happens if they do get ingested into the body in some form. So I think that's actually a really important link to make. And
that's right.
And do you would also cover off on fitting of masks as well, and which type of masks to use for which type of chemicals as well, because I think that's often an area where farmers go, well, I had my mask on, but either one, it wasn't fitted properly, or two, it wasn't the right type of mask for what you were doing. So
yeah, actually, look, there's been a lot more interest in masks generally over the last 2 years too. So, you know, people are a little bit more finely tuned to masks. But yeah, they're only as effective as they are. You know, they've got to be you've got to pick the right one, you're right, and it's got to be fitted properly, and it's also got to be stored correctly, washed correctly. And any replacements need to be sourced as well. You know, how often should you replace the cartridges? How long can you wear the P2 masks for? When do you pick a P2 or a P3? So there's a lot of discussion around respiratory hazards.
And that's really interesting, because I know with COVID there was a lot of talk about, well, you have to get the N92 masks, and then it was kind of like, well, that's fine, you can tell people they have to get that, but you need to also tell us what's the difference between that one and this one over here that this other company is selling, or, you know, that's right. An important distinction to make.
Yeah, and look, prior to last year, we've been doing what we call fit testing, where the farmers come in and we actually go through a process where we actually fit them with a mask and we actually test the efficiency of that fit. It's a little bit more tricky in the current climate, because that requires some sort of, you know, some huffing and puffing, and it's just a lot more difficult. But we can still theoretically talk about what principles, and give them some resources to make sure that they can actually, you know, think carefully about the parameters of what fitting involves, and about disposing, and about selecting, and about reading the material safety data sheets, so that they know that that's not the mask they should be using. They should be using one like this. So it's a general educative process.
It's such an important one, And so within the clinic that you run, what are some of the more common areas for improvement that you might see coming through in your assessments?
Okay. So I see a lot of increased risk for diabetes. I often see a lack of knowledge about the respiratory hazards. So, you know, dust, chemicals, fumes, just, you know, the rubbish that's in dust, what we call animal dander, you know, bits of urine and feather and fur and feces and all those things. It all gets bound up in the dust. And, you know, then that gets down into the bottom part of our lungs. So, knowledge, as we referred to, about how to select the appropriate protection, and not just personal protective equipment, but other strategies around protecting yourself from a respiratory hazards. I see commonly a lack of knowledge about how alcohol can impact on not only health, but well-being and safety. For female farmers, often they learn lots about protecting themselves more rigorously, especially if they're in that childbearing stage of their lives. So, you know, talking about the lifting of heavy weights, equipment that may not necessarily be designed ideally for, you know, our different female body shapes or smaller bodies, increased risk in pregnancy with some hazards, and also that, you know, that not prioritising time for yourself. And as we talked earlier about, you know, all those increasing demands and juggles that we've all had to deal with in terms of COVID. So, and you know, it's been a stressful time.
And I think as women on the farm too, we will often go, well, I'm just, you know, oh, he's out there working really hard, and so it's almost there's still kind of that traditional setting that sometimes happens, but it's different in that there's also the addition of, well, you know, the farm might be struggling financially, so I'm actually going to do all this work here on the farm, and then I'm also going to work another part-time job or sometimes full-time job not on the farm. And so there's all this added stress to try and keep everything going. And then, particularly if you're in your childbearing years, you might be pregnant at the time, that self-care element becomes so important, so important.
Yeah, yeah. And I think too, I mean, there's a lot of women are very active in agriculture.
Yeah,
It's a bit hidden, really. I think, yes, there are some more traditional arrangements, if you like, but more and more increasingly, women are just getting out there and doing all those things that blokes are doing. So, yeah, there are different needs, I think, for females. They've got different upper body strength. They're on average, a bit shorter than men with different body proportions. So sometimes the equipment and the tools doesn't necessarily match their needs.
yeah,
And yeah, but you have referred to, the working on off farm, the competing demands. Often, unfortunately, it falls to women more frequently to do that, caring for children, aging parents, grandparents. So
yeah,
yeah, the support, the sleep issues, and
yeah.
then often you compound that with a lot of seasonal tasks where you just have to keep going for very long hours each day. It's not a
Oh.
recipe for great health and safety, is it?
No, no. And
Yeah.
so you have mentioned to me in the past as well that you specifically like working with whole families in your clinic. Can you tell us also why is that, and what are the benefits of actually getting the whole family on board to go through a process such as an AgriSafe appointment?
Okay. So look, yeah, families are, I think it really depends on the type of arrangement that you're in. But if you can get everyone on board in a family and in a farming enterprise, then it's so much more beneficial. We all know that if everyone at a work site actually agrees on how and why things should be done, and we all have valued input into reviewing the how and why of what happens at work, it's usually a much more enjoyable place to work. So
Yeah,
if we're on a different page or there's conflict or argument, then there's just another added layer of negotiation that takes our eye off the main ball. So I think ag is no different from other work sites from that perspective, but it is more complex in some ways because, often ag is the home as well. So, and it's not unusual to have 3 generations working together or trying to.
yeah,
Um, so, and farmers also have an entrepreneurial streak. They're very independent. They work alone a lot. Um, they make decisions independently. So it's really helpful to ensure farm businesses really intentionally reflect on what they can do as a team to ensure the
yeah,
viability of their operation.
yeah.
And a healthy farm is really totally reliant on healthy farmers. So,
Oh,
if one person
absolutely.
has an injury or a chronic condition or even something that's a minor issue or they see as a minor issue, everyone in the family and community and often the wider family can be affected. So if everyone in the family goes along and has an individual AgriSafe clinic, then they're all getting the same message and then they're all coming together to say, look, I learned this. Do you think we should change that practice? Maybe we need to review how we're approaching work with that from that base of
Yeah.
more
And
information. Yeah.
that's right. And it's about also then having the knowledge to go, well, actually, maybe this should actually become a priority on us, and then having everyone on that same page that that is a
Yeah.
priority above these other things that
Yeah.
are maybe not as important, because we now know that if we don't do this, then that could significantly affect our health. If our
Yeah.
health is
Yeah.
affected, then the farm is affected overall. So yeah,
Yeah. It just
yeah,
opens the conversation really and lets people start that process of making more positive change
yeah,
and making it makes economic sense. You're
yeah,
right.
yeah.
Mm.
So and so when you're talking about whole families, is it mum and dad can bring in their younger kids as well, or do we have to be a certain
What we
age to
normally
access the
do,
AgriSafe?
yeah, I usually anyone over 18 So, I have had the male, the female, couple of employees, and any of the children who are working on the farm, as long as they're 18, we can see them. But ideally, everyone independently, because each person has separate individual health issues. So we like to make an appointment for each of those separately. So it might take a little bit of time to get through all of them, but then if everyone's getting the same information, then they can start that conversation.
Yeah, and it might also provide them, by having those individual appointments, it might provide them an opportunity to talk about some things that they otherwise might not in the group setting as well. So
yeah, exactly.
Really important.
Exactly.
Really important.
Yeah.
And so, well, you are an AgriSafe clinician. I know it's not the only string to your bow. Tell us a little bit more maybe about the other programs that you guys offer and what you work on and how they relate to and maybe feed off of each other as well.
Yeah. So our website is a real wealth of information just in its own right. It has links to our research, to farm fact sheets about a huge variety of topics. And that's a great place to start. It also has links to other podcasts we've done. So that's a really great place to start. And you can, as I said, you can find the AgriSafe link to express interest in that. There's also another new great tool called Farmer Hat, which it's free too. It's a mini online health assessment. And it's been designed to promote safe farming cultures and healthy personal behaviours. So it basically uses a traffic light system to give you some feedback and guide you to improve your practices. And it's repeatable, so you can track yourself over time and see how you're improving around various issues with your health, your well-being and your safety. So you can look at your own results online. And if you go to the doctor, for example, and you get some results, then you can go back online to a completely privatised site. You get a login and a password, and then you can re-enter that data and then see how whether you're jumping from a red traffic light up to a green traffic light.
So fantastic.
Yeah. So, and farmers love benchmarking their sheep and their cattle and their crops. So it's sort of a bit of a benchmarking for themselves personally. And then again, it makes a lot of business sense. We developed that a bit during COVID, where it was wreaking havoc on our ability to provide health assessments at field days where we often go and see people face to face. So we just thought that was really a good way to pivot into the pandemic, which everyone seems to be doing.
Yeah, everyone had to think of a way, didn't they?
Yeah, exactly. Yeah. So that's one tool. That's a really useful tool. What else have we got? We've got iFarm Well, which is, it's not something we do, but we have the link where it's an online service of modules farmers can actually do to build their capacity to stay mentally healthy in various ways. We've got Listen, LYSN, as opposed to Listen. Which is a link to telehealth counselling using sort of free Medicare rebated system with providers who understand ag and farming. So you can, access it from your tractor or your ute. We've got Campfire's a new one too, where it's sort of a text-based web chat service that's engaged at helping farmers identify and improve systems of work that support mentally healthy workplaces. So we seem to be sort of going back to mentally, the mental health field, don't we? Steering Straight's another new tool we developed in 2020. It's a bit of a 2-page checklist that's designed for farmers to pre-plan where to go if they get a bit stuck, a bit off track, a bit not coping so well. So always good to do that sort of planning, I reckon, when your head's in a good space. It's a lot harder to steer straight when you're getting off track and you're anxious or distressed. So, look, I just encourage people to hop on the website and see what we've got. Yeah,
absolutely. So, and I have checked it out myself, and it is such an enormous resource, and
Yeah.
well worth a look for anything in terms of, looking up fact sheets for specific ailments that might happen, or specific situations,
Yeah.
or accessing services like you've mentioned. So that's such a fantastic tool, and you guys should really be applauded on how well you've actually run that and created
Thanks.
it and added to it over the years. So really well done. But you did mention briefly there about pivoting in the pandemic. So let's have a little bit of a chat about some of the changes that you've seen across the course of the pandemic in your work. And I do kind of feel like in some areas within the pandemic, agriculture was overlooked a little bit in terms of how much it actually affected them, because a lot of agricultural places were still able to work relatively normally, while their city counterparts were locked down quite significantly. But was that actually the case? And from what you saw, what were, I guess, some of the flow-ons or changes that you've seen across the course of it?
Yeah, great question, Di. I think it's a bit of a mixed bag. I've had some farmers say to me, look, I feel a bit guilty. My life hasn't changed much. But others have had, really significant problems with seasonal worker shortages, or the border closure thing, supply chain issues for contractors, getting goods, postal things, all really challenging.
And one, I guess, that comes to mind for me is that around the outskirts of Melbourne, and probably in Sydney as well, the bigger cities, a lot of the farmers would regularly come into the city on weekends to go to markets and deliver into those markets, whereas over the course of the pandemic they actually couldn't do that, so they were left with this glut of produce that they then had to find a way to try and get rid of it.
Tragedy. And I think that a lot of those type of farmers have really pivoted to linking up with other agencies, trying to access online systems and ways to get rid of that not get rid of, but use practically the goods that they've created. So there has been a really big flow on, I think, in terms of that use of IT, and I think that maybe that's going to be one of the more longer lasting impacts of those changes, as long as you've got IT connection. But, farmers have become much more savvy. They're using IT to connect to groups, other groups, reach out, professional development, distant families. And they've been doing gym online with you, haven't they? All those sorts of things. Yeah. And I think, people are starting to realise they're not taking for granted that time with family and friends. They're really trying, they're really adapting. So that's really positive, I think. Some of the things have not been so positive in terms of what's been happening pandemic-wise. I think, the whole schooling thing has been really challenging. And I think that's created a lot of concerns for child safety on farm too, because kids are on farm a lot more. And ag is the...
Yeah, I was going to say, let's delve into that. How are there higher rates of, or I don't know if the research is out yet, but is there sort of higher rates of more on-farm accidents involving kids, or increased incidences of,
I don't think that the research is. The research isn't out, immediately, but I guess we just have to acknowledge that ag generally, even pre-pandemic, as it's the most dangerous industry in Australia. And given that home is often the workplace on a farm, and children are not at school so frequently, and they're a bit frustrated with not seeing their mates, possibly wanting to let off bit of steam.
Yeah. And even frustrated parents just kind of going, oh, I've had enough, just get outside, like.
Absolutely. Yeah, supervision of children on farms is always been really important, but when they're home more, and there's often more juggling to ensure routines are reviewed so children remain safe, is really important. Not easy always in a farm setting where parents are, as potentially as frustrated as the children, and they want their own space as well.
Yeah.
But I think, the pandemic means we actually should be even more focused on child farm safety planning, constantly review that plan. I'd really encourage your listeners to use the resources on our website to think about that. And think, well, what can I do as the adult to initiate this discussion and guide where we're going to be going in our enterprise, discuss the risks and reduce the risks for injuries and fatalities. How can I best involve my children in this conversation? And I guess that's another great reason to consider doing an AgriSafe clinic, because the more you know about your risks as an adult on farm, the better equipped you are to develop a child safety plan that is relevant in your particular enterprise. And children just don't have that cognitive skill to problem solve all risky settings, even though they often think they do.
Well, and it's often about educating them early as well, and getting certain habits in their lives that will just be normal as they then get older. So, things like, and it's very much like, schools now, kids have to wear a sun hat, and it should be the same in terms of, well, even though legally kids should be wearing helmets when they're riding quad bikes, we still know of many, many instances where parents are not enforcing that. And so I think it should be the same, like if you're riding a quad bike, you should be wearing a helmet. It should be like wearing a sun hat at school. There should be that same mentality around it, whereas I don't know that often we're quite there yet.
I'm sure we're not quite there yet. And look, that's often a conversation we do have within the AgriSafe clinic. And, the stats are really pretty horrifying, and quad bikes and machinery are, they're a major cause of both fatalities and injury on farms, and, presentations to ED. So, the latest data in around 2020 in terms of quad bikes is that over the 18 months from around, I think it's just prior to 2020, 22% of fatalities in Australia were actually associated with quads, and 35% were related to injury. So, quad bikes are really dangerous things, and children should not be riding adult quad bikes, and everyone needs to be wearing a helmet, because loss of concentration that can be horrendous, really.
We've just lost your mic a little bit, Morna. I'm not sure
if you
just there we go. I was going to say, I'm not sure if you just knocked it. There you go.
I think I might have. I think I might have.
There we go.
We're okay now.
Yeah. Super, super important. And it's interesting when you see on social media, and people will be putting up a photo with them on their quad bike, no helmet on, with the child on their lap, and they're riding along.
Absolutely.
And it's always, oh, we're having such a great time. And you think, I kind of see that and go,
I know.
We all cringe. Police, but it is one of those things. So quad bikes are a big factor on farm. Is there any other ones that kind of stand out for you in terms of kids and safety?
Yeah, look, water is an important one. Having a safe play area is really important. Large animals, because children are much smaller, and animals, so that's an issue. And personal hygiene too, they're often in the dirt, so you only need a tiny scratch and an infection can get in really quickly. So we've all been talking about hand washing and all of those sort of safety things that we can look after ourselves in COVID. But, it's just as important in farming in terms of soil-borne diseases. So, but yeah, water, animals, machinery for children, a safe playing area that's separate and safe, and it's been identified, and that, rules are okay. Rules give, boundaries, and boundaries are important when it's such a dangerous industry.
Yeah, absolutely. So I'm gonna flip the script a moment for you, and I'd love to chat just about you on a personal level, if that is okay with you.
Sure.
In terms of just looking at your personal experience of both living and working on a farm, because you have mentioned that a few times throughout the conversation about, the farm is your workplace and your home. So I guess what are some of the personal things, like how do you compartmentalize the roles that you play? And I guess, do you have any particular practices that you might follow in order to be able to do that? Tell us a little bit about
Great questions for any health professional or people who have that sort of face-to-face with the public. I don't always leave it at work. That is the mantra that you should. But I think sometimes it is a valuable strategy to just stop thinking full stop and then choose to rethink it all after an intervening space. So often a walk is really good. It just clears your mind and gives you perspective and distance. Sometimes, I guess, it just resonates because you doubt yourself sometimes whether you did the best job. Yeah. And so you rethink it, how could I have done better? So you rethink conversations, you reflect on what went well, but you're thinking about what went not so well or what could be improved, or if there's a challenging situation, then, it's hard not to leave it at work, to keep it separate. But I think strategies like debriefing with a peer is really valuable, because others in the same profession understand about boundaries and scope of practice, and finding that peer who is prepared to tell you honestly what you could have done better is really important too. So choosing that trusted peer and about what you expect from that trusted peer in a debrief before you start is often really helpful too. So sometimes someone you trust who is out of your industry but is a great thinker can be really helpful, I find. So they've got to understand confidentiality, of course. And of course, you would never mention names or identifying data. You have to sort of talk in generalities. Yeah. But, good friends who understand your foibles, I think if you talk in generalities can be great too. It is demanding. Some days are big and long and your brain bursts a bit, but really the things I do to look after myself professionally are probably similar to the things that we all do to look after ourselves just generally, healthy diet, good exercise, sleep, all those sorts of things. We just a different lens on top, really.
Yeah. So what are some of the strengths or confidence that you've gained from working both roles and having different hats within your community and your home life, and making it all work? What are some of the biggest strengths that you've learned along the way?
I think it's not just what I do for myself and the strengths that I find from redoing and getting experience. Sometimes your clients and your patients over the years at times give you plenty of strength too, which might seem a strange thought. It's not about me leaning on them for support at all, but it's more about things they do that give you those, I call them aha moments, those moments when all of a sudden the penny drops and what they've said is just pure gold. Yeah. And you always feel privileged. I always feel privileged to know that they trust me enough to share that those things with me. And I think the older I get, the more experience I have where people have shared very personal things with me, or it's almost like the more I expect it to happen. So I sort of get and my antennas start quivering, and I go, oh, something's going to get unloaded here. And so to a certain extent, you're sort of prepared for when that sharing comes. But having said that, occasionally it happens without you expecting it. And sometimes your patients just give you really direct feedback about how valuable or not so valuable your input has been. And that's always really special and very powerful too, I think. And that builds your confidence that you're either on the right track or you need to change track, or it gives you the opportunity, I think, to reflect on how you could have done things better. So I'm sure you're the same, Di. The people you serve in a professional capacity can teach you so much when you enter into that professional relationship in the gym with them. And actually, I have a story that resonated with me many years ago, and I've never forgotten. When I was a nurse on a ward, and it's quite relevant to the question that you asked, really. She was a woman from a non-English speaking background, and she came from hundreds of miles away, so she had no family support locally, and she was clearly petrified. She'd had some major surgery. She wanted to get out of bed. She needed to get out of bed. She didn't want to get out of bed. She needed to get out of bed. And she was so scared, and I just treated it like a normal day at work, I guess. But the very next day, she said to me, I want to talk to you. And she said, you were amazing yesterday, she told me. And I don't say this to puff up my own. Because I knew from the look in your eyes that you believed I could do it. Even though I was petrified, she said. She said, you gave me hope that I could turn my life around. And I've never, ever forgotten that feedback. It taught me how powerful one-on-one health interactions can really be. And even just the look in your eyes, you don't actually have to say things sometimes. It's that connection that you make with people that can be really powerful in people's lives. So that's a strength that comes from outside, I think. So I've never forgotten that one.
That's so lovely. And it is one of the most powerful moments, I think, for me in what I do with nutrition coaching and personal training, and is about seeing people do things that they didn't think they could do, and actually being able to give them the confidence to try in the first place. That is such a big powerful experience on both sides of the coin, not just for them and not just for me. So I can understand what you're meaning. It's such a great experience, and yes, very much reinforces the importance of some one-on-one interaction with people. That's right. That's exactly right. And harder to do these days, but very important. And so we're going to wrap up very soon, because we've been chatting for quite some time.
I've just looked at the clock. My goodness.
But one question that I do ask everyone at the end of these interviews and at the end of my podcast is, if you were to think back 5 or 10 years, is your life how you had planned it? And what would you redo 100 times over again?
5 years ago, right, 2016. Okay, so I was branching out with ward nursing and research assistant work in that ag space. And it was an opportunity that came out of the blue. But it made so much sense, and I just grabbed it. And my dad used to always say, opportunity knocks in strange places, but if you get a chance to do good things for other people, leap at it. So it was just sort of serendipitous, really, that I found out what National Centre for Farmer Health were doing and got on board. And that was really interesting. 10 years ago, 2011. Okay, so I was in the third and final year of my nursing. So I actually came to nursing later in my life. I did other things before that. That was a big year, finishing the nursing, and I had a daughter at uni. I had a son in Afghanistan. I had elderly, unwell parents, and it was a bit tough that year. But I was determined to finish that. I said, look, you've started, you just finish it.
Yeah.
And I suppose, that taught me that you always get curveballs, and you just have to knuckle down, really. Because if you make the decision that you want to do something, it will work as long as you're determined. What would I do 100 times over? Read lots. Reading's really helped me from reliable sources. Listen to everyone's point of view. Listening has really helped to challenge me and to reach out to other people.
Yeah.
Listening helps you get you out of your own headspace and give perspective. That really helps me. And don't just listen to those that agree with me. I try to listen to people who've got completely different things to say.
And listen to people that are not in your space too, not even necessarily that they have to disagree with you, but listen to people who are in a completely different zone to you.
Yeah.
And listen to what they have to say and try and learn from that. How can you apply that to your life? Or massively important.
I haven't always done this, but in my mind I try to, and that's really try and pick things to do to enjoy and love and sustain me. And if it goes pear-shaped, we'll just laugh and go to plan B. That's what I try to do.
Yes, doesn't have to be perfect every time.
No, because it often has to go to plan B.
Yeah. Oh, perfect. Well, I think we will wrap it up there. Thank you so much for jumping on board. You have been a wealth of information, and you have explained a lot about what services are actually out there, and particularly we both live in rural communities, and it's important, I guess, to note for people that you don't have to be living locally in this community to access your services. There are much of them available online and through telehealth now.
Exactly.
So I guess what's the website that people can actually go to have a look around and to get access into these?
So the good old www.farmerhealth.org.au.
Perfect. So thank you so much, Morna, and really appreciated your time today. It's been a fantastic conversation. And
I've really enjoyed the conversation with you, Di. You're a great conversationalist. Take care, and you keep doing that good work you're doing too.
Thank you. I will for as long as I can.
Good on you.
All right.
Take care.
Cheers. Bye.
Bye.